Bismillahirrahmanirrahim. Rabbi Zidni Ilma. Quote of the day. Sometimes life doesn't give you what you want, not because you don't deserve it, but because you deserve more. Assalamu alaikum. Under the supervision of Professor Dr. Saira Afzal, my name is Dr. Sadia Rafi, and today my topic of presentation is minerals, including calcium, potassium, phosphorus, and sodium. Learning outlines include the introduction of microminerals, including calcium, potassium, phosphorus, and sodium, their sources and related functions. And the learning outcomes include that at the end of my presentation, my colleagues will be able to describe the macro minerals like calcium, potassium, phosphorus, and sodium, their sources and important functions in the body. Introduction. Healthy sources of six essential nutrients includes, as we all know, the carbohydrates, fats, and proteins, including water, vitamins, and minerals. What are minerals? These are inorganic elements essential to the nutrition of humans. Minerals are essential to body functions, play several key roles in overall health and well-being, helps chemical reactions take place in cell, helps muscles contract, keep the heart beating. It has two groups, major minerals and trace minerals. Major minerals need to consume more than 100 milligram per day, at least 5 grams of minerals in the body. As we can say, the macro minerals or the major minerals include calcium, phosphorus, potassium, magnesium, sulfur, sodium, and chloride. And there's a list of the micro minerals as well. Trace minerals needs to consume more than 20 milligrams per day. The body contains less than 5 grams in total. Iron, zinc, copper, selenium, chromium, iodine, magnesium, molybdenum, and fluoride are included in it. The minerals which are included in my topic today I will present, and the remaining will be discussed by my respectable colleague tomorrow. Mineral balance. Body maintains tight control over mineral balance. GI tract regulates absorption from food based on the body's need. Minerals in gastric juices and that slough of intestinal cells are either excreted in the feces or reabsorbed through the large intestine. Kidneys excrete excess and reabsorb the mineral when the body needs them. Mineral functions. Minerals work together to perform important functions in the body: fluid and electrolyte balance, body formation, building healthy bones, maintaining a healthy immune system. Minerals helps maintain fluid balance. Minerals play a key role in fluid balance in the cell. As we all know, the extracellular minerals are sodium and chloride, and intracellular minerals are potassium with the help of calcium, magnesium, and sulfur. Minerals also participate as a cofactors. Cofactors are the substances that help catalyze a reaction. Minerals serves as cofactor in the antioxidant system, energy production, muscle contraction, and nerve transmission. As we know, the engine oil, it depends upon the vitamins and the minerals, essential nutrients for the maintaining healthy body functions. As we all know that it's the list of the minerals, and thus these are the sources from where we can get the vitamins, and like that minerals also list of the minerals, and these are the foods from which we can take the minerals, and all this combination is required as a fuel for the normal healthy functioning of our body. From where to get all these minerals at different sources of the food, like calcium we can get from cheese, milk, sardines, and like if I talk about the sodium, bread, cheese, chips, and potassium, legumes, meats, potatoes. So this is a list of the different minerals from we can get from the different food items. Good sources of minerals in the USDA My Plate Food Guide. As we all know, my food plate guides had different content like fruits, vegetables, grains, and proteins and dairy. According to recommendations, fruits 2 cups, veggies 2.5 cups, dairy 3 cups, grains 6 ounces, and proteins 5.5 ounces. And all these things contains minerals in them, as we can say. In dairy, calcium, phosphorus, magnesium, sodium, zinc, potassium, iodine, and all grains, fruit proteins. So it's a combination of different minerals from the different resource sources from we can get these. Mineral makes up bone and teeth. Mineral make up the crystalline structure, hydroxyapatite that gives strength to bones and teeth. Major minerals are calcium, phosphorus, and magnesium, and trace mineral is fluoride. So now one by one, discussing starting from the calcium. There are the different forms of the calcium. Most of the calcium in the body is stored in the in the bones as hydroxyapatite. Calcium in the plasma is 45% free ionized form, which is physiologically active form. 45% is bound to protein, predominantly albumin, and 100% complex with A9s like citrate, sulfate, and phosphate. In routine, these all tests are measured in the blood test. So, correcting total serum calcium for hyperinsulinemia with corrected calcium, corrected is equal to calcium measured, and it is a formula by which we measure the serum calcium in the case of hyperinsulinemia. These are the different sources of calcium like milk, cheese, and seafood. Functions of the calcium are the calcifications of bones and teeth, blood clotting as activator of thrombokinase. It is important for maintenance of the heartbeat, regulate the transport of ions across cell membrane, and it is particularly important in nerve transmission and muscle contraction. It is cofactor for several enzymes. In the abnormal level of calcium may be due to disease of parathyroid, kidneys, and disturbed vitamin D levels. Body mass and age. Body mass decreases with age, peak around 30. As we can say, it is the bone mass and it is age. As the age advantage, there's a maximum at the age of 30, the bone density. Then the bone mass decreases in men and women both, but more it is more dominant in females. Calcium recommendations are during adolescence are set 1300 milligram per day to ensure that the skeleton will be strong and dense. Between the ages of 19 to 50, recommendations are lowered to 1000 milligram per day, and over 50, the recommendations are raised again to 1800 milligrams per day to minimize bone loss. Rickets is a disorder caused by a lack of vitamin D, calcium, or phosphate. It leads to softening and weakening of the bones. There is so serum and urine calcium and phosphorus levels. Calcium and osteoporosis. Osteoporosis is a silent thief. It leads to progressive loss of bone mass that occurs in the elderly of both sexes. It is pronounced in postmenopausal women, mostly women 45 years or more. It is characterized by frequent bone fractures, which are the major disability among the elderly. Phosphorus. Different forms of phosphate. Most of the phosphate in the body is also stored in the bone as hydroxyapatite. Most of the remainder of the body's phosphate is intracellular as a component of phospholipid in cell membranes, DNA, RNA, ATP, and ATP. The small fraction of phosphate that is in the serum exists as circulating phospholipids and inorganic phosphate. Inorganic phosphate consists of hydroxyphosphate HPO4 minus 2 and H2PO4 in a ratio 4 into 1 at the pH of 7.40. It is physiologically active and but is typically made in routine blood tests. And the functions of phosphorus includes it enters in the formation of bones and teeth, formation of high energy compounds as ATP, enters in the structure of nucleotides and nucleic acids, genetic material. It is important for the biosynthesis of phospholipids present in cell membrane. It is a carbohydrate metabolism as exhaust ester. It acts as buffer to maintain the acid-base balance of cellular fluid, enters the formation of the coenzyme as NADP. Food sources of phosphorus includes the main food sources for phosphorus are food containing protein, for example, egg, milk, meat, and soya. Major mediators of calcium and phosphate balance are parathyroid hormone and the calcitriol, which is active vitamin D. Parathyroid hormone is really produced by the parathyroid gland. Its net effect is increase the serum calcium and decreases the serum phosphate. Whereas the active vitamin D, it is from diet or a cholesterol-derived precursors with the help of UV light, and it requires enzymatic step in the liver and kidneys to become active. So its net effects is that it increases serum calcium and as well as serum phosphate. Here it one increases and second decreases. Fibroblast growth factor 23. Fibroblast growth factor 23 is a member of fibroblast growth factor family which is responsible for phosphate metabolism. The main function of it seems to be regulation of phosphate concentration in plasma. It is secreted by osteoblast and osteoclast in response to elevated calcitriol. It decreases the reabsorption and excretion, increase excretion of phosphate in the body. The synthesis and regulation of parathyroid hormone. It is secreted by the parathyroid gland, and its secretion is primarily regulated by serum calcium. So, in cases if there is high serum calcium level, the parathyroid hormone decreases, and it is low, then the parathyroid hormone secretion increases. In normal physiological condition, magnesium plays a parallel role to calcium. However, with significant magnesium depletion, there is decreased PTH secretion and parathyroid resistance, leading to hypocalcemia as well. As you can see over here, the serum secretion depends upon the levels of the calcium in the body. Calcitriol increases blood calcium level by promoting absorption of dietary calcium from the gastrointestinal tract and increasing renal tubular reabsorption of calcium, thus reducing the loss of calcium in the urine. PTH also indirectly stimulates osteoclast. However, the main effect of PTH is to increase the rate at which the kidney excrete inorganic phosphate, the counter iron of calcium. The resulting decrease in serum calcium causes calcium ion to dissolve out of the bone, thus increasing serum calcium. Potassium. The food sources are mainly vegetables and fruits. All different colors, fruits like purple, green, orange, yellow are rich source of potassium. What are the functions? Potassium, like sodium chloride and bicarbonate ion, plays an important role in the osmotic regulation of body fluids. Sodium mainly found in extracellular tissue, whereas potassium principally present in the cell, it is intracellular. It plays an important role in nerve and muscle excitability. It plays roles in carbohydrate metabolism as a cofactor, energy metabolism catalyst, and ATP production. It is critical to heart function. Sodium. Most of the sodium of the human body is present in the soft tissue and body fluids. Like potassium, it is concerned with the acid-base balance and osmotic regulation. It is a chief action of plasma, blood plasma, and other extracellular fluids of the body. Much of it is ingested by common salt and excreted in urine. Common food sources are salt and seafood. Health benefits of the sodium, its regular fluids, prevents loss of water, remove excessive carbon dioxide. Sufficient sodium improves the skin, balance iron, prevents cramp, develop the brain, improves teeth, and prevent dryness. One of the American Heart Association, Healthy for Good. So, how too much sodium affects your health? In this, they have shown now 9 out of 10 Americans consume too much of the sodium, and it is the different sources from they get the sodium, in which they 3,400 milligrams amount of sodium an American consume an average in a day, whereas the requirement recommended is 1,500 milligrams or less. It is recommended by the for the ideal health heart. And so, shake or salt keep the sodium intake in check as part of the overall heart healthy eating pattern that emphasizes variety of fruits and veggies, whole grains, low-fat dairy products, skinless poultry and fish, nuts and legumes, non-tropical vegetable oils, limiting saturated fats, trans fat, sodium, red meat, sweets, and sugary intakes. And so the excess level of sodium and salt may put you at the risk for enlarged heart muscle, headaches, kidney disease, osteoporosis, stroke, heart failure, high blood pressure, kidney stone, and stomach cancer. So excess level of sodium salt may cause increased water retention that leads to puffiness, bloating, and even weight gain. Sodium functions as transmission and conduction of nerve impulses responsible for osmolarity of vascular fluids, regulation of body fluid levels, assists with regulation of acid-base balance by combining with chloride and bicarbonate to regulate the balance. Sodium shifts into the cell and potassium shift out of the cell. It is called sodium pump. Global updates. Basically, renal diet basics. Eating correctly, it is very important in the kidney health. People with kidney diseases need to monitor intakes of sodium, potassium, and phosphorus especially. So we can see over there, these minerals play a very important role, and the patient with the kidneys issues have to take care very much about this. Then there was an article about the role of potassium and sodium in your diet, because they help. These are the electrolytes that help to maintain body fluid and body volume, so it can function normally. So consuming 2 liter potassium and too much sodium can raise your blood pressure, and they have told, sorry, to take both in the right quantity. Excess of anything can lead to rise in your blood pressure and the risk of the heart disease and stroke. Then again, another article on the importance of the phosphorus. Its recommended dietary intake is mentioned. It is very important. The sources of the phosphorus, because the groups at risk of phosphorus inadequacy are like preterm newborns, people with genetic phosphate regulation disorders, people with severe malnutrition. So this should be addressed, and the proper intake of the nutrients play a very important role. Then in the recent advances, CDC has the role in it, the vitamins and minerals nutrition for healthy growth and development. It is that the vitamins and minerals deficiencies can be devastating. These are the critical for several important bodily functions, often referred to as micronutrients. Vitamins and minerals are not produced in the body, with the exception of vitamin D. Instead, they are consumed through food and supplements. Micronutrient deficiencies can have devastating consequences even for urban children. So they have emphasized so much for the intake of proper minerals and vitamins for the normal development and growth. So these are my references. Now moving towards the multiple choice questions. Which of the following helps in the regulation of blood volume and blood pressure? Iron, iodine, sodium, and phosphorus.
Sodium.
Sodium.
Sodium. Yes. Describe about the sodium pump. Yes, sodium. Excessive intake of calcium in our diet results in stroke, diarrhea, constipation, kidney stones.
Constipation.
Kidney stones.
Yes, the
Kidney
correct
stones.
answer is kidney stone. Pregnancy and lactation is known to decrease calcium requirements, results in bone mineral loss from the skeleton, decrease the rate of dietary calcium absorption, affects bone minerals content later in life.
C.
It's the B, results in bone mineral loss from the skeleton because the mother requirement is increases and during the period of pregnancy and lactation. Yes, due to the baby, the demand increases as the mother is not taking proper the supplements of the calcium to maintain the calcium level in the body, then it leads to result in bone mineral loss. What is the average daily recommended amount of calcium for an adult woman 51 and older? 1000 milligram, 1200 milligram, 1300 milligram, and unlimited.
1000.
Not in this case. In the case, it is recommended that women above 51 and older should take 1200 milligram. And if there are severe deficiencies, then this amount can be extended towards 1800 milligrams. 1200 to 1800 milligrams per day intake of calcium. The best source of phosphorus is or are dairy products, meat, fish, sour drinks, beans, and peas or nuts.
Beans and peas.
No, sir. The best source of phosphorus is dairy products, meat, and fish. But two essential dietary minerals are mainly responsible for maintaining cell membrane potential that is critical for nerve impulse transmission, muscle contraction, and heart function. Sodium and chloride, calcium and phosphorus, potassium and sodium and phosphorus and iron.
Potassium
Potassium
and
and sodium.
sodium.
Yes, absolutely correct. It is potassium and sodium. High dietary sodium intake is generally associated with decreased calcium excretion in the urine, increased risk of fracture, decreased dietary calcium absorption, negative calcium balance, and bone mineral loss.
Decreased dietary calcium
It's, it's the negative calcium balance, bone minerals. As I have told, the excessive sodium intake leads to the osteoclast activity and it leads to the increased release of the calcium. So it leads to the bone mineral loss. Which of the following is true about dietary calcium? A typical calcium intake is of most adults between zero point 0.5 to 2 milligrams per day. Activated vitamin decreases absorption of dietary calcium. Incorrect. There is clear evidence that people who consume more than average amount of calcium have a lower risk of bone fracture and absorption efficiency inversely related to calcium intake, so that a high proportion is absorbed when calcium intake is low. Sorry.
C.
Mhm. I have told you the absorption efficiency is D because absorption efficiency is inversely related to calcium intake. So that higher proportion is absorbed when calcium intake is low. Because I have told that the release of parathyroid hormones is monitored by the calcium. If their levels are high in the body calcium, then the hormone secretion is low, and if the calcium levels are low, then the levels are high for the absorption. So it is inversely. These factors increase risk of osteoporotic fractures, high bone mineral density, high body weight, high lean mass, or poor muscle strength.
High body weight.
No, sir, I have read this. It is a poor muscle strength. Reading about this. They have said that poor muscle strength is the very main factor in leading to the osteoporotic fracture. No doubt, the bone density is also reducing, is everything, but the muscle mass is also lost, or there are weak muscles. So the strength of the muscle is very weak, and it plays a very important role in it increases the risk of osteoporotic fractures. Bone mineral accretion is rapid in the first weeks of the fetal life, is slow in infancy. In childhood, adolescence, and childhood predicts risk of fracture in old age is particularly high after the menopause in women. Yes, see, it is childhood, adolescence, young adulthood predicts risk of fracture in old age. It is the key, and thank you so much.
Okay, thank you very much, Dr. Sathya. Again, a very nice presentation, especially you have brought different important aspects of mineral metabolism in highlight, and this is the most wonderful part of this presentation. I have certain queries, especially about your MCQs, about the mineral metabolism and the hormones that are involved in the mineral metabolism. If you please go to your question number 9. MCQ number 9, please.
And
Right. Here, the high body weight is one of the factors that leads to increased osteoporotic fractures, because increased body weight leads to more risk of having weight on these bones. And if it is osteoporotic, there would be more fracture, or the probability of osteoporotic fracture increases. You have said poor muscle strength. Even in high body weight, the muscle strength becomes poorer. So if these are the options, I would also second Dr. Daud's opinion that it is the high body weight that leads to most of the fractures, especially if there is osteoporosis along with it. Please, if you go to your question number 4. Right. Here, the average daily recommended amount of calcium for an adult women 51 and older, again, your B's and C, both options are correct. So if you have two correct options, it is very difficult to know what is the best option,
okay,
because we know there is a range, yes,
yes,
and
ma'am.
in the range it is from 1200 to 1800.
Yes,
So
ma'am.
even 1300 is the right option.
I will correct it.
Right. If you please go to your question number 5. The best source of phosphorus are, here your right option uh, is
Dairy
standing
products.
out from the rest of the options. We all know that the soft drinks should not be here, because the soft drinks are not the organic food that we always encourage. From a point of view of the nutrition, we always discourage junk food and soft drinks. So the B can't be any option for any of our MCQ. It is something that is standing out, that the B option is wrong. So we have only the three main things that we have to choose. अब जो मसला ये है कि आपको डेयरी प्रोडक्ट्स और मीट और फिश ये एक ग्रुप में लाई नहीं करती. मीट डिफरेंट ग्रुप है, फिश
Yes,
डिफरेंट ग्रुप है, डेयरी प्रोडक्ट्स डिफरेंट ग्रुप है, बीन्स डिफरेंट ग्रुप है. ओके, यू कैन ग्रुप इट विद पीस. सिमिलरली, अगर आप सॉफ्ट ड्रिंक्स निकाल दें, यू
yes,
कैन
ma'am.
पुट
With you.
dairy products in one of the group, and the remaining groups cannot be reclassified
Yes, ma'am.
according to the classification of nutrition.
Yes, ma'am. I'll correct my MCQs and then I will upload on the group.
Right. Please go to your question number 8, please.
Okay, ma'am.
Right. Here, activated vitamin D decreases absorption of dietary calcium. Next is incorrect. I couldn't get it. What
Oh,
is
ma'am, sorry.
incorrect?
Sorry. That is a misprinting. I will correct it.
Okay, right. Now, according to the hormonal metabolism of calcium and minerals and the hormonal influences on it, I want one or two more slides about how the parathyroid hormone, especially in the case of chronic renal failure, is affecting the calcium metabolism. What are the different clinical features? Because we have a very strong dimension of prevention that is associated with our intake of calcium and phosphorus, and intake there may be decreased intake of certain important minerals that increases the risk of osteoporotic fractures, especially when there is a special condition or comorbidities like chronic renal failure, chronic liver disease, and other important endocrine abnormalities like Cushing syndrome, and there may be the increased adrenal cortical activity, or there are insufficiency of hormones like adrenal cortical hormones, etc. So all these hormones, they affect the mineral metabolism, and there are a room for prevention by giving the adequate amount of calcium, phosphates, etc., in a particular condition. We have seen in chronic renal failure, especially, a there are situations where there are increased hyperparathyroid activity leading to osteoporotic, especially in the vertebrae, etc. So would you please highlight those important points
Yes, ma'am.
from the lens of prevention, how the calcium and phosphorus has to be given in those particular patients who are having renal failure or renal or liver disease, or having Cushing syndrome, iatrogenic, or due to the hyperadrenal activity.
Okay, ma'am. Inshallah, sure.
So, otherwise, it is a very good presentation and well done.
Thank you, ma'am. Thank you so much.
After adding these few slides, please share it in the
Yes, ma'am.
postgraduate course.
Yes,
Thank you very much. If
thank you.
anybody has any question, please let me know. Okay, if there is no question, I would also like Dr. Sadia, please add few points about the prevention of pepper pot appearance of the vertebral column,
Okay,
how
ma'am.
it can be prevented, what is the mechanism behind it, and a few slides about it. Okay,
Yes, ma'am.
thank you very much.
Thank you so much. Thank you.